Hey everyone, Dr. Charlie Johnson, physical therapist at Physical Therapy in Johnson. In a previous video, I shared with you the latest recommendations and guidelines for medical practitioners like myself when it comes to knee surgery, okay? Here they are again in the British Medical Journal as of last year. And again, they strongly recommend against all knee surgery, okay? With that being said, if you're scheduled for surgery and you're wondering about the pros and cons, I just want to lay them out so it's clear as can be, okay? So surgery, no surgery. No surgery includes physical therapy as well as some medications and possibly injections, okay? So first things first, you'll have to go to the operating room for your surgery. I think that would make sense, right? Versus for the conservative no surgery, you're going to be in an office setting, okay? You're going to have anesthesia and the risks that come with that in surgery, okay? There's no anesthesia, and if it's an injection, a lot of times they'll spray like a little spray and stretch. It's just a little cold spray that will kind of numb the local area, but that's it, okay? PT, obviously, no anesthesia, okay? If you have the surgery, you have to consider that you're going to be recovering for 2 to 6 weeks or more if you have a meniscal repair, okay? And you're not going to be able to put weight on that leg for 2 to 7 days, okay? Which doesn't seem like a long time, but then after that, you need PT anyways. So you could nip it in the bud and just go to PT here and get things done and get it over with, okay? Or you could go through all this and then have to go anyways, okay, and go over to there, okay? What we know is that any type of surgery to the knee and any type of swelling around the knee actually inhibits the ability for the muscles to function around the knee. So we're going to have to teach you how to kind of get them back online and get you moving better, okay? So now you're a PT. And then you're off work. So you're off work depending on if you have a physical job or desk job, something like that. It will vary, but you're going to be off work for probably a couple weeks, okay? There's no driving for 1 to 3 weeks because the surgery is performed on the knee, and you're going to be having to move pedal to pedal, especially obviously if it's your right leg, or maybe you're a double-footed driver or you drive a stick shift or something, okay? But expect to not be able to drive right away. And then I forgot this, but think about the follow-up appointment. So after the surgery, everything's not all well and good now. You have to go up for follow-up appointments to make sure there's no infection, the wound's healing, get the stitches out, make sure there's no clots or anything like that. So I mean, you have to go to consistent follow-up appointments and make sure that you're doing okay there. There are follow-up appointments on this end. There are PT appointments or maybe an appointment for an injection, but that's it, okay? So we've got a lot of money being spent over here. We've got very little money being spent over here, and really this aims to get at the root cause versus just the source of the problem. This is the Band-Aid. This is how we do it, okay? So point is that this is fix myself, someone fix me. And unfortunately, passive treatments like this, especially knee surgery, are being proven to be less and less effective. So if you want to get control of your symptoms and work towards feeling better and moving better, reach out to us directly. We'd love to help you out and give you an opinion. 484-552-3767. Thanks.